I'm Jessie Fullenkamp, LMSW, University of Michigan School of Social Work, class of 2010. I use she, her, and hers pronouns. Currently, I'm sheltering in place in Detroit, Michigan with my family, and we are taking a moment to pause and celebrate the class of 2020. This probably isn't how you pictured your graduation day. You're not physically with your students, professors, colleagues. Your family and friends don't have the chance to visit campus and see the culmination of your commitment to learning. Some of you might even be searching for jobs during historic levels of unemployment. Some of you might be in unexpected living situations, and some are even mourning the loss of loved ones due to COVID-19. This is a lot. I hope that you can hold both of these realities, grieving what we are losing in the pandemic, as well as finding joy in this moment of your accomplishment. To be honest, when I was graduating, I didn't feel completely prepared for the work ahead. I worried that my knowledge of the DSM was too limited, or my experience writing policies was not sufficient. So I'm here to tell you, it might be hard to recognize at this time, but as social work students, you have been preparing for this moment. You are ready. Not because you know exactly what to do. There's no playbook for responding to COVID-19. You are ready because you've been trained to respond and adapt to the world around you, and to approach challenges using integrated social work to create comprehensive and systematic change. In this time, which feels unprecedented in so many ways, I think about lessons from the past. My great-grandpa Fullenkamp was a young farmer when the Spanish flu hit in 1918. There was so much death in his community that he was called upon to help the undertaker move bodies. I try to imagine what he was thinking in this moment, agreeing to prepare his wagon and horses, normally used on the farm, to instead carry people that he knew, to their final resting place. While there is sadness in understanding the magnitude of the loss a pandemic brings, I also feel strength, the strength of those who went before me. Here I am 100 years later, knowing that my family was adapting to be what their community needed, and that I can do the same. So, what does it look like to adapt as a social worker today? In Detroit, at the Ruth Ellis Center, we work to create a world where lesbian, gay, bisexual, transgender, and questioning, or LGBTQ, youth are safe and supported no matter where they go. Our agency was formed because social services needed to adapt to meet the needs of LGBTQ youth who experience significant barriers to resources, which translates to alarming health and safety outcomes. It didn't take a pandemic. Every day, questions of survival impact our work. To move beyond survival, toward a focus on thriving, we continue to adapt through examining the very questions and assumptions we have about our own work. This work is too important to continue with practices we know don't facilitate health and safety. The world has changed, and social workers will be on the front lines, wearing masks, holding virtual sessions, advocating for new forms of unemployment benefits, adapting how we help facilitate health and safety in our current climate. In addition to being adaptive, social workers bring one of the most important tools in our fight against the pandemic, integrated social work, where we connect interpersonal practice with macro or system level thinking. I know, it isn't as compelling as a vaccine, but it really has been the driver of needed change. Integrated social work doesn't place importance on one method or concentration over another. Instead, it requires all of the strategies of social work to inform one another. I'm proud to practice integrated social work at the Ruth Ellis Center. It isn't easy. People have a lot of ideas about what can and can't happen in Detroit. But for our work to move from charity toward transforming the system, we have to facilitate the wisdom of the community we serve, directly informing our policy and system level work. For us, this means that the youth we serve are also on staff. This means that we have an education, evaluation, and research department embedded within the agency. This means that our very existence creates necessary change at micro and macro levels. So what does integrated social work look like in this moment? Interpersonal practice helps us to understand how this pandemic has all of the inputs of trauma for many individuals. We weren't expecting it, we weren't prepared for it, and we couldn't stop it. Social workers will be a resource for healing when processing the trauma of this pandemic. Integrated social work recognizes that the power of these services are limited without system-level thinking. Individuals and communities where we provide services are living in systems which resulted in privilege and existing vulnerabilities to only be amplified during this pandemic. Understanding how systemic racism has resulted in Black communities being disproportionately impacted by COVID-19 is essential for social workers. We have and will continue to facilitate access to clean water, safe housing, and equitable health care, but also interrogate why barriers to these basic needs exist in the first place and advocate for change. This is integrated social work. Healing requires change, and change requires healing. We all have a role, and we are all needed. So, on your graduation, in the midst of a pandemic, know that you are now a part of a profession that will continue the work we have always done. And because of our adaptive and integrated practice, we are ready. You are ready. Congratulations, class of 2020.